Welcome to Common Man. Today's episode, our guest is Hemant. Hemant has two masters, one in biotechnologies and the second one is in MBA. He is also currently pursuing a PhD in public health. Let's talk more about public health and PhD program in Hemant words.
All right. Thank you, Prashant. So as you rightly pointed out, Prashant, I've got a couple of master's degrees. My first master's was in biotechnology, and then my second master's was an MBA program. I then went on to pursue a couple of certifications as well, and now currently pursuing a PhD program in public health. It's from a university based out of the UK. It's called Lancaster University, and I chose this program during COVID. As COVID was a big public health issue as well, and I got really interested in public health at the time when COVID happened. And also, public health is very closely related to what I do in my line of work, which is pharmaceuticals, developing medications for various diseases. And so I thought this would be a good program for me to pursue, which is why I'm in this program. 3 years down, probably a couple of more years to go.
Just for the audience, can you explain
Yeah.
what exactly public health means?
Absolutely. So health in layman terms, right, would just mean it's basically an art and science of making sure that the public or people at large have good health, right? So how do you do that? You basically include all the communities, you include individuals, societies, you include companies, organizations, everyone there is, right? To make sure that you're providing the right circumstances for people to actually have good health. So to give you some examples, vaccination, right? So that's a very important thing that we do when a child is born, right? We make sure that a child is vaccinated. We vaccinate a child with multiple different vaccinations to make sure that the child does not go on and develop those diseases as the child grows up. That's one way of eradicating diseases from the world. Good nutrition, right? Making sure that good nutrition is actually available to all the children, all the adults. That's something that the government really looks into as well. That these are nutritional programs run by schools, by charities, by organizations, so that all the children, all the nursing mothers, people who cannot afford food can still have access to good nutritious food so they can have good
Any
health.
supermarket or
Yeah.
any fast food place, the food that we get is not nutritious. It's high calorie, high fat, mostly high sugars, high salt, right? How this public health programs or education is helping to educate people about these toxic food, I would say.
The biggest, I guess, challenge that the public health community is facing currently is heart disease and stroke. And that's probably what you're alluding to as well. That if you do not have access to good nutritious food and nutritious products, people would go on and eat those products, maybe end up developing diseases like diabetes, obesity, a host of different cardiovascular diseases that they could possibly develop. And that's the biggest challenge right now that the community is actually facing, to make sure that we actually curb those diseases and make sure that we provide access to nutrition as well as medicines, which will help lower down the incidence of these indications. So certain things that the government is doing, which will help in making sure that these diseases are not as prevalent as they are right now. You obviously have seen that all the products have nutritional info on the baggage, right? So you see that this product that you're buying has certain amount of carbs, certain amount of proteins, certain amount of sodium, and the government is actually making sure that that label is as accurate as it should be. So the people who are actually buying those products are well informed about what exactly are they consuming as well. So there's multiple programs like that. So good advertising, of course, of the products, um, making sure that the advertising is done truthfully, and there is nothing false about the claims that the products might be making. You obviously cannot advertise M&Ms as healthy, right? It might have less sugar, but you cannot say this is a healthy product that you can consume. So you make sure that the advertising that the companies are doing to promote these products, which might not be as healthy, that these advertisements are actually truthful. And that's just a couple of examples of how the government actually is trying to promote good health and good nutrition.
Extending your own answers, I feel that the amount of information we have available in social media or anywhere else in the internet is a lot of information is there. um, you touched about the advertisement and how it will affect, and then some government agencies are looking after the advertisement to show the to give the truthfulness, right, which is happening, I can see that. But at the same time, because of overwhelming information, and it's very difficult to filter what is right, what is not. For example, cereals. Initially, I thought cereals are most healthy food. Then later, I've seen so many videos saying that cereals has lots of sugars and salts, which are not good. So I stopped consuming cereals as a breakfast.
Right.
Right? How, as a common man, we could understand and relate this information, and which one? I mean, how do we perceive this information, right?
How we perceive the information on the labels?
Uh-huh. I mean, there's multiple information is available, right? There's multiple information available, which says the cereals are good, cereals are bad, right? How I
Right, but
can understand?
exactly, and that is why it's very important to filter out all the noise. By noise, I mean there's just like you mentioned, there's multiple different websites providing information on the same thing, right? Serial, whether they're good or bad. You have to go to the right source. Make sure you're going to public health websites to try and find out information. You go to websites that are actually legit. The information that's actually coming from the government, information that's coming from top doctors or public health professionals. If you go and read blogs and just read about what people are actually commenting about, you might not get information which is all truthful. So you have to go to the right source of information to make sure that you have the right ammunition to make the right decision as well. So, as a PhD student, I am conducting a research, myself, and I found a certain gap in the way cancer is treated among immigrants, and I'm using that to answer certain questions. And so this would ultimately, hopefully, answer questions how immigrants are treated, right, for their cancer, and also we're making sure that the different demographics are also included in the research work, right? Meaning different age groups, both the genders, people speaking English versus who are not as fluent in speaking English in English, because as I mentioned, I'm researching about immigrants here in the U.S. So I'm making sure that all the different demographics are actually included to make it more comprehensive. And so hopefully this research work would actually add value to the literature, and maybe can also help in developing policies which currently exist in cancer treatment, specifically for immigrants, and can actually improve the experience of these immigrants going through their cancer journey as well. So a lot of this research work impacts the policies that the policymakers are actually making about treatment of certain diseases and indications, and that's how it directly impacts the medical system of the country completely.
That's a great, interesting theory to analyze. But do
Yeah,
you have
yeah.
any concrete examples on how immigrant is affected with cancer more than a maybe resident? I don't know, permanent resident. I don't know how do you say that. But do you have any differences as of now in terms of how the cancer is affected between? Um,
Yeah.
mhm.
So the research work that I've taken up is about the experience of immigrants going through the cancer journey, right? I'm not particularly addressing whether or not they have more cancer compared to Americans or Europeans in general. Data suggests that if you talk about Indian immigrants, right, first generation Indian immigrants coming from India, data suggests that compared to other populations, Asians and South Asians are actually more economically more stable. They have more money, which is why they're also able to spend on their treatment as well. And so health outcomes are actually better, right? But not necessarily the experience. This is a gap that currently exists, right? And why experience might not be better is because of a lot of factors, cultural factors. There's a lot of stigma around cancer within Indians and Southeast Asians in general. People don't really like to talk about cancer, right? It's something that's considered taboo, and they just hide it from other people. They don't like to talk about it. When they talk to their healthcare professionals, they're not very open in discussing different items, right? As compared to, let's say, a regular American person, Indians would not ask as many questions about their disease. How exactly is the disease progressing? What are the next steps? How can we tackle it? What other options I have available, which might improve my quality of life as well? Because there are multiple treatment options that the physician can actually suggest, and each of these treatment options can have an impact on your quality of life, right?
And now I understand what exactly public health and what exactly your research is really doing it. But when I was trying to understand public health, again through
Uh-huh.
YouTube and other medium,
Yeah.
um, I come to one particular video where they said that the conventional medicine program and then public health education both go
Mhm.
against each other. Do you have any comments
Against
on
each
this
other.
one?
Again, now that's I completely differ from that comment. The conventional medicine and health, public health go hand in hand. Now, you know, public health actually gives you the data. So it tells you what the communities are actually facing right now. There might be, a certain disease that certain communities are actually facing. How prevalent is that disease? What actually is causing that? All those factors are determined by public health. They actually do a thorough analysis. That allows the medicine developers to then see that there is actually a need in the market to develop that medication, because people are getting affected by it. And if people are getting affected by a certain disease, so it's important, very important, to actually keep looking into public health and keep looking into how diseases are actually affecting the community, and then develop the medication. So it actually goes hand in hand. So you look at the data, you develop that medication, and then you do the intervention, meaning the conventional medication then would come into place and make sure that the individual is actually getting treated. Now, public health looks at the community level, right? It looks at society level. It's a very large umbrella term. Medicine is basically on an individual basis. So public health would look into data on a large basis, right? On an overall basis, looking at communities, looking at society, areas, cities, states, and countries, so so on and so forth. And then using that data, the medicine developer, the pharmaceutical company, will then develop the medication for that particular disease. And then the conventional medication, medicine would come into place, where the physicians or the healthcare providers will then take that medication and make sure that it's actually being given to people who are in need, so that disease level comes down, that we're not unnecessarily spending more money in curing certain diseases which can easily be cured by giving certain medications, so that people are not suffering either. And
Well, the comment came just because if public health is really good, then there is no business for regular medicine. But I know it's just a comment. I just want to hear your point of view. That's it.
so if public health is not good, there is no business for pharmaceuticals.
Yes.
Well, if public health is not good, it's really important to actually have that data coming from public health professionals, obviously, right? So
That's interesting. I definitely agree with you. Public health is important, and then researching more and more about
yeah,
how people get affected with the different disease is important for both
yeah,
vaccination as well as nutrition. And
absolutely,
thanks a lot. Thanks a lot for joining us and then giving valuable information about public health.
absolutely, absolutely, Prashant. My pleasure. Thank you so much.
Thank you.